Do's and don't when you run a fever during pregnancy. Pregnancy is a beautiful and transformative journey, but it is not without its difficulties. Running a fever during pregnancy is one such issue that expectant mothers may face. While fevers are not uncommon, especially when the immune system is already stressed, it is critical to understand the risks and take appropriate precautions to ensure the health of both the mother and the developing baby. Welcome to another episode of Omegy. In today's video, we will be talking about the do's and don'ts when one has a fever during pregnancy. From the delicate first trimester to the exciting final stretch, navigating fever during pregnancy requires knowledge, caution, and timely medical attention. Therefore, it is crucial to handle the situation with care and take necessary steps to manage the fever effectively. So, here are the do's and don'ts when you are having a fever during pregnancy. Do's. 1. Consult your healthcare provider. If you develop a fever during pregnancy, it is critical that you contact your healthcare provider. They have the knowledge to assess your condition, consider any underlying health issues, and provide appropriate advice based on your specific circumstances. 2. Monitor your temperature. Using a thermometer, keep a close eye on your body temperature. Take regular readings and keep a record of the results. Sharing this information with your doctor will help them determine the severity and duration of your fever. 3. Stay hydrated. Staying hydrated is critical during pregnancy, especially if you have a fever. To stay hydrated, drink plenty of fluids such as water, herbal tea, and clear broths. Hydration aids in the regulation of body temperature and promotes overall well-being. 4. Rest and take it easy. If you have a fever during pregnancy, make sure you get enough rest. Resting allows your body to fight the infection and recover more quickly. Prioritize sleep and avoid overexertion, which can aggravate your symptoms and prolong your recovery. 5. Dress comfortably. When you have a fever, wear loose-fitting, breathable clothing. Loose clothing allows heat to dissipate from your body, assisting in temperature regulation. Heavy layers should be avoided because they can trap heat and cause discomfort. 6. Take ACETAMINOPHEN if recommended. ACETAMINOPHEN or paracetamol is generally considered safe for pregnant women when taken as directed. You can take ACETAMINOPHEN to relieve fever or discomfort if your healthcare provider thinks it's appropriate. However, before taking any medication during pregnancy, always consult your healthcare provider. Don'ts. 1. Avoid self-medication. It is crucial to refrain from self-medication, especially during pregnancy. Many over-the-counter medications may not be safe for pregnant women or require specific dosing adjustments. Always consult your healthcare provider before taking any medication, including fever-reducing drugs. They can guide you towards suitable options that are safe for you and your baby. 2. Don't ignore high or prolonged fever. High or prolonged fever during pregnancy should not be overlooked. If your body temperature remains elevated for an extended period or reaches a high level, it is essential to seek medical attention promptly. Ignoring or neglecting a persistent fever can have adverse effects on both you and your baby. Your healthcare provider can evaluate the underlying cause of the fever and provide appropriate treatment to ensure your well-being and the health of your baby. 3. Steer clear of nonsteroidal anti-inflammatory drugs or NSAIDs. Nonsteroidal anti-inflammatory drugs or NSAIDs like ibuprofen and aspirin should generally be avoided during pregnancy unless specifically prescribed by your healthcare provider. These medications can potentially harm the developing baby and should be used only under professional guidance. Your healthcare provider can recommend alternative options that are safe for pregnancy and can help manage your fever effectively. 4. Avoid overheating. It is important to prevent overheating your body when you have a fever during pregnancy. Overheating can raise your body temperature further and pose risks to fetal development. Avoid exposure to external sources of heat, such as hot baths, saunas, or hot tubs. Opt for comfortable, loose-fitting clothing and ensure that your environment is adequately cooled to maintain a stable body temperature. 5. Don't delay seeking medical help for severe symptoms. If your fever is accompanied by severe symptoms like intense abdominal pain, persistent vomiting, severe headache, shortness of breath, or reduced fetal movement, it is crucial to seek immediate medical attention. These symptoms may indicate a more serious underlying condition that requires prompt evaluation and treatment. Your healthcare provider can assess the situation and provide appropriate care to ensure the well-being of both you and your baby. Risks. Having a fever during pregnancy can potentially pose risks to both the mother and the developing baby. Some of the potential risks associated with fever during pregnancy include increased risk of birth defects. The first trimester is a critical period of fetal development, and high temperatures, such as fever, can potentially increase the risk of birth defects. Maternal fever during early pregnancy has been linked to neural tube defects, which affect brain and spinal cord development, and heart defects. Preterm labor and delivery. Pregnancy fever, especially in the second and third trimesters, can increase the risk of preterm labor and premature birth. Preterm babies are born before the 37th week of pregnancy and may experience complications due to their immature organ systems, such as respiratory and feeding difficulties. Maternal dehydration. Fever can cause increased sweating and fluid loss from the body, potentially leading to dehydration in the mother. Dehydration can cause a variety of health problems for the mother, including dizziness, weakness, and decreased blood flow to the uterus, which can affect fetal well-being. Fetal distress. Fetal distress can result from a high fever, which is characterized by changes in the baby's heart rate and oxygen supply. Fetal distress is concerning because it can indicate that the baby is not getting enough oxygen or nutrients. Medical intervention may be required in such cases to monitor the baby's condition and ensure their well-being. Potential effects on fetal brain development. Some research suggests a link between high fevers during pregnancy, particularly in the second trimester, and an increased risk of neurodevelopmental issues in the child. Maternal fever has been linked to conditions such as autism spectrum disorders and cognitive impairments, though more research is needed to establish a definitive causal relationship. It's important to remember that the risks mentioned above are only potential outcomes, not guarantees. Furthermore, the severity and duration of the fever, the underlying cause, and the baby's gestational age are all factors that can influence the level of risk. Keep in mind that every pregnancy is different, and the information provided here is general in nature. When dealing with a fever during pregnancy, it is critical to seek personalized advice and guidance from your healthcare provider. Your healthcare provider will consider your specific circumstances, medical history, and any potential risks to make the best recommendations for your health and the health of your baby. A fever during pregnancy can be a cause for concern, but armed with the right information and guidance, expectant mothers can effectively navigate this challenge. And that wraps up the video. We hope you learned something, mother-to-bees. Do you have any questions? Feel free to write them down in the comments section below. Please like and subscribe. Once again, this is Amaji. Thank you for watching, and we will see you in the next video.